Good morning, good afternoon, good evening to those of you in the room here. Good morning, and to our guests online across Canada. And we have some international guests as well for this wonderful day. I'm Brian O'Rourke, the President and Chief Executive Officer of CADTH. Now, for those of you who perhaps don't know CADTH that well, I'll give you just our elevator speech here. We're an independent, not-for-profit organization responsible for providing Canada's healthcare decision makers with objective evidence to promote the optimal use of drugs, of medical devices, of procedures, of programs, of diagnostics, and other clinical interventions. Ladies and gentlemen, it's an exciting time for CADTH. In last week's federal budget, Finance Minister Bill Morneau announced an injection of new funding for CADTH. Beginning in April of 2017, very soon, CADTH will receive $35 million in additional funding spread over the next 5 years, and $10 million per year in new funding after that. This significant investment by the Government of Canada will promote pan-Canadian collaboration and improve the management of health technologies across Canada. And I'd like to thank Minister of Health Jane Philpott for continuing to ensure that credible evidence informs the healthcare decisions that affect us all. And today, of course, is another big day for CADTH. I'm incredibly proud to announce the launch of the 4th edition of the Canadian Guidelines for the Economic Evaluation of Health Technologies. I'd like to thank all of you that are here in person and all of our online guests. I'm told that there are roughly 650 people participating in today's launch of the guidelines. The previous edition of the guidelines was published more than 10 years ago, and there have been some significant advances in the methods for economic evaluation since then. The rewrite of the guidelines took roughly 2 years to complete and involved hands-on input and validation from the top tier of health economists in Canada and around the world. And we consulted with patient groups, with industry experts, and other stakeholders throughout the process. These guidelines are a key document for CADTH and for all Canadians. They enable us to provide decision makers with reliable, consistent, and relevant economic information. They set out best practices for determining the comparative value of health technologies. They are an essential part of health technology assessment and make a huge contribution to the quality and sustainability of healthcare in Canada. The guidelines are also important to health technology assessment organizations around the world. Some have adopted our guidelines, and while others have used them as a model to develop their own guidelines. The 4th edition of the Canadian Guidelines for the Economic Evaluation of Health Technologies will be important to many stakeholders, patients, clinicians, policymakers, industry, and academics. In fact, they are a crucial source of information for anyone who either uses economic information to make decisions about the adoption and use of health technologies or are impacted by those decisions. Because the guidelines are used by Canadian healthcare decision makers to inform decisions about which drugs, medical devices, and procedures to reimburse, they affect the lives of virtually all Canadians. The economic guidelines are indeed one of the most downloaded documents on the CADTH website. In the past 12 months alone, the current guidelines were downloaded a staggering 11,875 times. With the new guidelines being launched today, I expect that number to rise substantially over the coming months, and I know our IT folks are a little worried about the next few weeks and the number of downloads. So over the next hour or so, some of the experts who were involved in updating the guidelines will provide a high-level overview of the 4th edition, highlighting the key changes and why these changes were made. We're not going to be taking any questions today. There will be other opportunities for that, and I'll outline some of those opportunities at the end of today's session. Today is simply the launch of the guidelines. It's more of a celebration, a rare opportunity for some very hardworking people to rest on their laurels for a moment or two. We do have some printed copies, I think, around on some of the tables, And for those of you that are with us in person, you can follow along with those guidelines. Those who are online, you can download the guidelines at this URL from our CADTH website, cadth.ca/health economics, if you did want to follow along with the presenters today. So before we get started, I want to acknowledge some of those hardworking people that I mentioned a moment ago, the members of the Health Economic Guidelines Working Group, several of whom are with us today. The 4 academic members are Sterling Bryan, PhD, Professor, School of Population and Public Health, University of British Columbia, and Sterling will be joining us today via teleconference. We have Doug Coyle, PhD, Professor and Interim Director of the School of Epidemiology and Public Health at the University of Ottawa. Doug is, of course, with us today. Dr. Murray Cron, Director, Toronto Health Economics and Technology Assessment Collaborative, better known as CADTH, and Christopher McCabe, PhD, Capital Health Endowed Research Chair from the University of Alberta. Let me also recognize Elizabeth McCarron, a CADTH staff member who is also a key member of the working group. And many other past and present CADTH staff were involved behind the scenes in getting us across the finish line. I'd likely miss some people if I tried to name everybody individually, so just let me collectively thank all of you for a job well done. And last but not least, Karen Lee, who is CADTH's Director of Health Economics and an adjunct professor of epidemiology at the University of Ottawa. Karen was the driver of this project and chair of the working group. And I would be remiss if I did not pause here and ask you to join me in thanking Karen for her tremendous work in leading this project. So Sterling, Doug, and Karen are now going to walk you through the role of the guidelines, the process that we use to develop them, and some of the highlights in the 4th edition. So first up is Sterling Bryan. So please join me in welcoming Sterling live, hopefully, from Vancouver. Sterling, you're up.
Okay, thank you very much, Brian. I hope you can hear me okay. So I'm just going to provide some overview before we get into the detail, answering some questions like what are the guidelines and what are economic evaluations. So just to start with, the slide that's titled What Are the Guidelines? I think before I start, I should just say a very big thank you for inviting me to be a member of this panel. It's been a pleasure to serve in that capacity. So what are the guidelines? So really what we're trying to provide in the guidelines is a set of standards to produce high-quality economic evaluations. So it's a reflection. What we've done in the process of developing these guidelines is try to reflect upon what might be considered accepted best practices and best approaches to the conduct of economic evaluation, looking for areas where we have consensus amongst methodologists in terms of what are best practices for conducting economic evaluations. So we've tried to find consensus. We've not always achieved consensus because there are areas where simply methodologies are currently developing, and some of those are developing at a rapid rate. And so there will always be a need to be updating the guidelines. But we've tried to make a line in the sand at this point and say what represent best practices and articulate those in the guidelines. Okay, next slide, please. So what are economic evaluations? I'm sort of assuming that most people on the line and in the room will know the answer to that question. But just to sort of give a sense of why it is that we conduct economic evaluation and what the frame is for the guidelines that we've prepared in this edition, one of the things that I think is important to emphasize is the focus of the guidelines for conducting economic evaluations directly to inform decisions. So the decision context and the decision frame is a critical piece, and we've tried to reflect that, and obviously particularly in a Canadian context, and then develop guidelines that can be very much focused on seeking to have impact and inform decisions about resource allocation in Canadian healthcare. So the focus of the guidelines is not about an academic exercise. This is very much about practically seeking to have impact and to inform resource allocation and reimbursement decision-making in a Canadian context. And what we're trying to do with economic evaluation guidelines is provide a consistent framework for assessing the cost impact over time of adopting a particular technology, as well as the benefit impact over time associated with that technology. So what we're saying is that the economic evaluation should be fit for purpose to address the specific decision problem. So it is about selecting methods that are applicable and appropriate given a specific decision problem that's being addressed. So the goal, so one of the things that's important to recognize, I think, is that we're taking a position that says in a Canadian context, i.e. typically a publicly funded healthcare system with that has a social objective of maximizing population health. Next slide, please. So why are the guidelines important? So they're important, I think, both to the research community, those analysts and researchers who conduct economic evaluation, as well as to the decision-making and policy-making community. So from a researcher perspective, having guidelines and actually following the guidelines provides the opportunity to have impact. And so this is an opportunity, I think, to ensure that the work that's done, the analytic work that's done, is viewed as being credible and should be then used in the context of informing decisions. And from the decision maker point of view, the guidelines are important in part to ensure that evidence-informed decision-making is happening, and it can be happening making use of credible and reliable evidence from in terms of the economic impact. And the other reason why I think these guidelines are important is because of Canada's position in the health technology assessment world. I mean, clearly Canada has and continues to be a leader in health technology assessments, and CADTH is obviously at the forefront of that. And so the guidelines that are Canadian guidelines have impact and influence internationally, and can be used and are used to advance the standards that are applied in other jurisdictions. Next slide, please. So continuing on the theme of why are the guidelines important, I think it is very much around this notion of having impact. So actually ensuring that the work that's done by economic evaluation researchers is seen as being credible. And so the guidelines ensure some degree of consistency as well. So we are trying to provide a framework that allows for the comparison of alternative economic evaluations that are conducted, because they're being conducted in a consistent way. So we try to indicate what that level of consistency should be, but we are also, and we'll go into some detail on this, indicating that some variation is possible and in some contexts to be expected. So the impact issue is around ensuring that we've got evidence that can lead to informing decisions and actually such that Canadian decisions made in a Canadian context about reimbursement and reallocation are made using high-quality economic evaluation evidence. The next slide, please. So what impact do the guidelines have? So as Brian has already indicated, this is the most frequently downloaded CADTH document. This is clearly now going to spike on the back of the launch, one would expect. And I can speak on the basis of one of my other roles within CADTH is to chair the Health Technology Expert Review Panel, which is on the non-drug side of CADTH, the panel that makes determinations and recommendations about devices and healthcare procedures. And economic evaluation is a critical piece in guiding the discussions and deliberations of that expert review panel. It's clearly not the only piece of evidence that we draw upon, but it's a critical piece. So having high quality economic evaluation conducted in a consistent way in line with these guidelines makes for a much higher quality decision and deliberation process in the context of the Health Technology Expert Review Panel. And so, I think like the other thing to say in terms of the impact of the guidelines is, again, in terms of the impact internationally and the position of Canada internationally. So these guidelines will have influence and should have influence more broadly, both within Canada but then internationally as well. So I'll stop at that point and I'll let Karen pick up from now.
Great, thanks, Sterling. Happy to have you join us today by phone. So how did we get to this event today? Well, a lot of work has happened over the last 2 to 3 years to get us to where we are now. And a lot of people have been involved, as Brian mentioned in his opening remarks, from CADTH staff to working group members, researchers from the academic community in Canada, as well as internationally, and a broad range of stakeholders. So in terms of the process, the scoping of the update to the guidelines started in 2014. And based on a review of existing topics in the 3rd edition, methodological developments within the topic areas, and feedback on the 3rd edition from stakeholders, an update to the guidelines was felt to be needed. In the summer of 2014, the Health Economics Working Group was convened. And this is an active working group where all members participated in the update of topics, engaged in discussions regarding the issues, and provided direction for changes, and considered feedback that was received. Topic areas where methods had changed significantly were identified, and gaps in research were determined by fall of 2014. Requests for proposals were issued based on gaps in research, which were needed to update specific topics. Academic groups were identified, and work was commissioned in the winter of 2015 for a number of research areas. These commissioned technical reports are posted on the CADTH website and have, to date, been downloaded significantly. So these are popular documents. Topic areas were identified for major and minor revisions in 2015, and in the fall of 2015, input from stakeholders was sought through a survey for general views on the update, as well as areas in which revisions would be required. The update of topics continued in 2016, with separate topics being consolidated into a draft document, and alignment amongst the topics were ensured. In the summer of 2016, the draft guidelines were subject to technical peer review by content experts both in Canada and internationally. Peer reviewers were invited to review topic sections or the full draft of the document. CADTH reviewed the feedback that was received with the working group to determine the best approach moving forward. In the fall of 2016, the revised draft guidelines were posted for broad stakeholder feedback, and feedback again was reviewed by CADTH along with the working group to determine the best approach moving forward. And that takes us to today, with the posting of the final version of the 4th edition of the guidelines. The intent at the outset of this project was to be as collaborative as possible. As such, updates were issued via CADTH alerts. There were a number of presentations provided at CADTH symposia to provide status updates, and there were 2 formal opportunities for stakeholder input. The first opportunity, as mentioned previously, was the stakeholder input survey, which occurred in December of 2015. And the objective of this was to ensure that no aspects were missed as part of this update. Information was obtained on the topics for which additional information or clarification were required, areas where methodological advancements were made, and more guidance would be needed. The feedback that we received from this input survey was aligned with CADTH's thoughts on the update. It provided validation with respect to the topics for which substantive updates were required, and it confirmed that while not all topics would require major revisions, that all topics should be reviewed as part of the update. The second formal opportunity for feedback was the posting of the draft guidelines for broad stakeholder feedback in November of 2016, and the draft was posted for a 4-week period. And extensive comments were received. The general themes to the comments included the need for more information on recommended approaches to guide those conducting economic evaluations, the need for greater clarity to understand what specifically would be required in terms of best practices recommended, and the need for tools to help support the use of newer methods that were recommended and discussed as part of the guidelines document. CADTH reviewed all of the stakeholder feedback, and comments were discussed in collaboration with the working group, again, to determine the best approach moving forward. This was a very useful part of the process as it ensured clarity in the guidelines, as well as that no aspects were missed. Some of the feedback received pertain to items that fall outside the current scope of the guidelines, and these aspects will be considered as separate projects moving forward beyond the work of the guidelines. So we've been referring to the guidelines a bit so far, so let's delve into them a little more. The CADTH guidelines represent a set of standards pertaining to key aspects that comprise an economic evaluation, and there are 15 topics in total. The document is split into a few sections. The introduction, which describes the theoretical foundations of the guidelines and the use of economics in decision-making. The guideline statements provide recommended approaches for each of the 15 topics. The guidance in detail provides more detailed information to support the recommendations outlined in the guideline statements, and appendices are also provided to provide supporting information. As part of the update, the 4th edition of the guidelines have the same number of topics as the previous edition, so 15. However, a new section was added entitled Analysis, and we will get into each of the topic sections shortly. As well, the section on generalizability, which was from the 3rd edition, was folded into applicable topics for greater relevance. The format of the guidelines have remained relatively similar to the 3rd edition, and this was based on stakeholder feedback in which it was felt that the format of the 3rd edition was very usable. However, theoretical foundations for the guidelines have been explicitly stated as part of the 4th edition. And so there are different views that exist on how collective decisions regarding healthcare resource allocation should be informed. Given the Canadian context and the viewpoint of the social decision maker acting on behalf of a socially legitimate higher authority, such as an elected government, who seeks to maximize some policy objective, such as improving overall population health, subject to available resources, this perspective was adopted. And as such, the goal of economic evaluations is to inform social decisions. Since the socially legitimate higher authority is elected into office, the decision maker is assumed to make decisions reflective of what the general population considers socially valuable. And it's these social values that should be reflected in an economic evaluation and which underlie the recommendations made in these guidelines. As well, newer methods have been incorporated as part of the guidelines, and in some cases, it's acknowledged that research areas are evolving and we may need to revisit the guidelines relatively soon. There are a number of overarching changes in the 4th edition that affect a number of the topic areas. One significant change that Sterling alluded to involves the focus on a decision problem. The position taken by the guidelines is that the role of economic evaluations is to inform decisions, and as such, best practices for a number of topics depend on who the decision maker is and what the decision problem is. As well, a reference case has been introduced, and the reference case describes a recommended set of methods to increase the comparability of results across evaluations. The intent is to aid decision makers by promoting uniformity and transparency and allowing the comparison of different technologies as well as decisions. There's a focus on the importance of uncertainty in the 4th edition, and this is highlighted in the recommendations within a number of topic areas. And here there are clear implications for the decision maker to understand the need for further research to help resolve uncertainties. The 4th edition of the guidelines stressed transparency in methods and reporting to allow full appraisal of the evaluations. In addition, variability in terms of heterogeneity was highlighted specifically as a topic where further guidance was provided to increase transparency and reduce uncertainty. So we'll now go through the 15 topics to highlight key changes and the relevance of them, starting with the decision problem. As mentioned, a key change to the guidelines is the focus on the decision problem, which is compared to the study question as it was referred to in the third edition. And this change was made to make clear the role of economics in the purpose of informing decisions. And as such, information must be relevant to the circumstances in which the decisions are being made to ensure the use of economics in decision-making to maximize policy objectives, such as the health of a population. The framing of the problem will ensure that the scope, design, and reporting of the evaluation meets the needs of the decision maker. And to ensure that decisions can effectively be made, discrete decision problems are required for each perspective and subgroup of interest. For types of evaluations, no significant changes were made to this topic. The focus remains on the cost-utility analysis as the recommended form of analysis, and this allows for comparability and full assessment of uncertainty, which is important for decision-making. The other forms of analyses are not recommended, as they do not provide the decision maker with the same level of information on which to make decisions. The target population of the analysis should be specified and consistent with the decision problem. Separate decision problems should be specified for all subgroups of interest to ensure a full set of analyses are generated. More clear guidance was also provided in defining these target populations based on factors such as natural history, effectiveness of interventions, utilities, and costs. And the purpose of this recommendation is to ensure that the health of the population is maximized in that there is a full understanding of the cost effectiveness of interventions of interest in different populations. In terms of comparators for an economic evaluation, no significant changes were made to this topic. However, guidance remains committed to the comprehensive approach to selecting comparators to ensure a full understanding of the opportunity and costs associated with the decision. The selection of comparators should be linked to the decision problem. And now, I will hand it over to Doug to go over the remaining topics.
Thanks, Karen. And thanks again to CADTH for allowing myself, Chris, Murray, and Sterling to work on developing these guidelines. We really thought this was a great opportunity for us to bring economic evaluation forward, to make these guidelines the most up-to-date, the most reflective of best practices of any guidelines in the world today. And CADTH should be very proud of the fact that they took this on, adopted some controversial positions, but that those positions are very much reflective on the theoretical basis of what we were underpinning our guidelines with. Can you move forward? Oh, I can move forward. Excellent. First faux pas. Okay, so the fifth guideline statement refers to perspective, and we want to take this back very much to the concept of the decision problem and the idea of the guidelines reflecting a social decision making viewpoint on social choice. So therefore, we kept with the same guidance as we had before, that the reference case should be that based on a publicly funded healthcare system, but we provided stronger theoretical basis to that by linking that directly to the decision problem. In the previous guidelines, there was a lot of feedback we got in terms of the need for further clarity, so we made this far more clear in the revised guidelines, so hopefully that those concerns have been addressed. There's not many significant changes to this section on time horizon. Again, it's designed to reflect the decision problem faced by a decision maker. So again, it's a strong theoretical basis to the revised statement. And it's made it clear that time horizon should be long enough to capture all relevant information on long-term costs and benefits, not just the cost of the treatments, but their impact downstream in terms of the effects on the progression of disease. Probably one of the biggest changes in the guidelines relates to the discount rate. Previously, there was no theoretical basis for the discount rate within the CADTH economic guidelines, and that is a problem, I think, in most guidelines throughout the world. There's typically a 5% discount rate being adopted because that has been the standard practice that people have used for many years. We commissioned work to develop and define what the theoretical basis for determining a discount rate would be, and that work was done by Mike Paulden and colleagues at the University of Alberta. Based on the principles that underline the guidelines, that we are adopting a social decision-making viewpoint on social choice, it was decided that the theoretical basis shows that the discount rate should be derived based on the real rate of interest for government bonds faced by the level of government that funds the healthcare system. And the applied work that Mike's group did demonstrated that a discount rate of 1.5% for costs and benefits is the appropriate discount rate given that basic underlying principle. So a substantive change to the previous guidelines, but one that we feel is theoretically defensible. In the modeling section, there's no significant changes. We keep our emphasis that the model should be as complex as necessary, but not unnecessarily complex. And that's a key issue to argue about. We're seeing many models that are overly complex, and the need should be that the model addresses all that is necessary, but only all that is necessary. We focus a lot in the new guidelines on the idea of considering existing well-designed economic evaluation models and using these as a template for future studies. So build off previous models, avoid duplication of efforts. We're hopeful in the next few years that that practice will be adopted more, and therefore a template of existing models that could be used in further studies can be developed. There's a lot of changes to the section on effectiveness, with a lot more increased details about what's covered under this topic. A lot of new methods have developed over time since the last guidance. So in other words, there's development in the area of network meta-analysis, novel trial design, and the use of real-world evidence in economic evaluation. Some of these areas are still evolving, and so as Karen alluded to, some of the guidance might need to be updated far sooner than the gap between the third and fourth edition. But what we've tried to do is provide as much detail as possible about these new methods, as well as more detailed guidance on how to report the methods of extrapolation, which is a key factor in assessing the legitimacy of the ways of effectiveness data are incorporated into an economic evaluation. So therefore, although some of these aspects continue to evolve and should be revisited, we're trying to provide as much of an up-to-date guidance in how to use these new novel methods within economic evaluation. The measurement and valuation of health hasn't changed much apart from its topic name. It used to be called valuing outcomes, but now we're focusing more on the idea of measuring the health changes and placing evaluation upon these. We provide more evidence on how to combine utility values and how to value non-health effects, but the underlying principle that utility values should be reflective of the general population's valuations are still consistent. Within resource use and cost, there's no real significant changes to this section. There's a new updating costing guidance from CADTH that we refer to within this section, and there's some additional information on the inclusion of patient and informal caregiver time, as well as the use of administrative data within economic evaluation. The analysis section is the only new section within the CADTH guidelines. It is a crucial section because it really does reflect the underlying objective of the guidance, which is to provide evidence or guidance on how to maximize population health within social decision-making. The guidance highlights the importance of conducting all analyses probabilistically. This is crucial given our social objective of maximizing population health. The details on how to conduct these analyses are provided in detail within the guidance, and it allows us to make sure that we're estimating the most exact estimates of expected values for costs and outcomes and incremental cost effectiveness. It also describes how results should be reported in detail as well. In uncertainty, there is a lot more clarity than previous, with focus on three major types of uncertainty: parameter uncertainty, which is addressed probabilistically; methodological uncertainty, which is comparing the reference case analysis to non-reference case analysis; and structural uncertainty, which is addressed using scenario analysis, which relates to changes in the actual model design. The guidance takes a very clear and unequivocal statement that deterministic sensitivity analysis for parameter uncertainty is no longer recommended, as it does not appropriately account for uncertainty in terms of expected values for costs and outcomes. We also make it clear that all scenario and sensitivity analysis should be probabilistic as well, so the conduct of any deterministic analysis would be considered inappropriate. Variability is no longer part of uncertainty, but is addressed through the target population guidance, which Karen has mentioned already, again with the fundamental aim of maximizing population health. The guidance actually has a fairly concise but clear statement about equity within economic evaluation. It's aligned clearly with our social decision maker viewpoint that all outcomes should be weighted equally regardless of the characteristics of those receiving health effects. So when people talk about the tension between equity and efficiency, that is a misnomer. It's quite clear here that efficiency is achieved by having a clear and unequivocal equity statement. It's aligned with the social objective to maximize population health, but though analyses can be presented in a disaggregated form to allow consideration of any other societal objectives that decision makers wish to address. The final guideline statement relates to reporting. I'm glad to say there's no significant changes to this section. Basically, everything we do to develop those expected values and costs are being refined to update and be more reflective of the best practices currently in our discipline, but the actual reporting of the results is pretty much the same standard as it was in the third edition.